2019, a third of all deaths worldwide were caused by heart diseases. And this includes, well, heart disease itself or other cardiovascular diseases like stroke and heart attack and clogged arteries. And we were talking about clogged arteries yesterday, right? And we said if somebody has atherosclerosis, right, where the buildup of plaque and fat in the artery walls and it's preventing blood flow to tissues, it can make them die and it's not good for your body, right? Some risk factors for that would be being overweight, right? Being obese, not exercising enough, smoking, having high cholesterol, high triglyceride levels in the blood, high blood pressure, right? Diabetes, things of that nature. But did you know, and this I think is a very interesting follow-up video to what we were talking about yesterday with clogged arteries. It's just so cool. Did you know that oral health could be an indicator also of cardiovascular diseases? That's right. Poor health within your mouth could increase your risk for developing heart disease. So what's going on here? What's the evidence? How is this even possible? And what can we take from this to improve our health and reduce our risk in another way for developing cardiovascular disease? Well, when it comes to your oral health, right? How do our teeth break down, and how even after they break down would this increase your risk for heart disease? So with your teeth, they have a protective coating, enamel. We all know that. Enamel is the hardest substance in the body. Fun fact, if you guys were curious. And enamel is produced beginning in fetal development through infancy and up till 8 years old, right? So up until 8, and then after 8 years old, we don't produce any more enamel for the rest of our lives. And so that means we need to keep some good oral health, and we need to protect that enamel to protect our teeth. And what happens is there are a lot of bacteria in your mouth. They're not just in your bloodstream, all over your skin, under your fingernails. They are in your mouth as well, of course. And so there are good and bad types of bacteria. Bad types of bacteria love sugar. They love to eat sugar and help them perpetuate, right? And take over things in your body. And so this is one reason that people with type 2 diabetes are at a higher risk for infection. There's a ton of sugar in the blood. And when you have crud in the blood, as we say, that'll increase your risk for a whole world of complications. And they're going to eat up this sugar and thrive, right? And we obviously don't want that for bad bacteria. It's good when it's good gut bacteria, right? So these bacteria, they'll eat a bunch of sugar in your mouth, on your teeth. When they eat that sugar, as a byproduct, they produce acids. These acids break down your teeth and cause dental caries, also known as cavities, right? So that is one major way, really the major way that we get cavities, okay? Now, they're breaking down this enamel, which, again, we don't make any more of after age 8. And when we lose these teeth, we lose this enamel and we lose our teeth, what happens is now we have these open gums. And now we have these open gums. Well, that is yet another way that bacteria could potentially enter the body, enter the bloodstream, and increase inflammation and increase your risk for heart disease. And that's the idea here. That's, one of the mechanisms they think, by which this could happen really in simple, right? And of course, there's some more to it. But analyses have tried to prove this correlation, right? At least show some association, and they're mostly observational studies. So, they'll show associations in terms of oral hygiene and risk for heart disease, but they can't necessarily prove causation, right? As all observational studies cannot. One analysis in 2019 did fail, or it was 2018, whatever, did fail to show an association between oral hygiene and heart disease, because there was a significant association. But then when they adjusted for smoking status, which smoking also increases your risk for heart disease, of course, right? Like stroke and heart attack and cardiovascular disease itself and clogged arteries, right? There was no association, right? But other studies have shown positive associations. So we kind of had mixed research until now. A new analysis came out pretty recently of 12 observational studies, and they followed these people from anywhere from 3 to 49 years, and they measured the amount of teeth they had left and their risk of dying from heart disease. Okay? Now, the results showed that those who had lost most of their teeth, and I'm talking slow because these words are really important, they lost most of their teeth or all of their teeth, had a 66% increased risk of dying from cardiovascular diseases as compared to those who lost just a few or none of their teeth. Okay, and this is powerful because they also adjusted for confounding factors, right? Other things like smoking status. They all adjusted, all 12 of them adjusted for age and smoking status, which are both obviously very important factors there. And 10 of them adjusted for another 5 confounding factors, potentially confounding, we should say, involved in increasing your risk for heart disease, right? Things like obesity and lack of exercise, right? And triglyceride levels and all that kind of stuff that we were just talking about before, and cholesterol, right? And so what does this mean? And what can we take from this? Well, this is saying if you eat a lot of sugar, right? Well, sugar is going to, again, provide some food for these bacteria to thrive in your body, these bad bacteria, right? Sugar doesn't just make your liver produce more fat and more cholesterol, which can clog arteries, right? But it's also helping these bacteria thrive. And when you have a lot of sugar in your mouth, guys, what do we think of with candy? Your grandma always told you, don't eat too much candy, you're going to get cavities, right? And you just think about it for not having those pearly whites and you know, maybe not being able to chomp down a bunch of food as well and having to drink smoothies for the rest of your life, which sounds shitty, right? But as good as smoothies can be. Try making one with blueberries and frozen blueberries, frozen spinach, frozen fruit, put some water in there, put some, you know, ginger root and lemon. That's a great smoothie I love to make. But, you know, now we can think of it in terms of causing heart disease in some other way, potentially, right? Because again, these are observational studies. They just show association, right? There's some correlation, but not necessarily causation. And so if we can avoid products that have added sugars and eating way too much sugar, well, this is another way that it could kill you, right? Is it could decay your teeth and give the bacteria some food. And when it decays those teeth, there's now another pathway for those of you who are late to the party here, for them to get through the gums into the circulatory system and to increase inflammation and increase your risk of dying from heart diseases. So really fascinating. I thought I had to share that with you guys. Who do we got on here? I know my eyes messed up. It's gonna get better. If it doesn't get better within a week, I'm gonna go in to the doctor and get some antibiotics, right? But you know, I'm gonna put a warm compress on for now. Thank you. I appreciate that. Appreciate that, Sabrina. What's up, Angie, Antonio, Meg? Happy Sunday. Good morning, by the way. We're early today. Noel, King Reed. Oh, really? That's pretty cool, Sabrina. Hell yeah. Anna Couture. Frank in the middle. Connor, Sabia. What's up, girl? Happy Sunday. Dave, that's the beast from Nice. What's up? Up early today, getting after it. I'm going to do arms today. That's what I'm doing. And Purple, thank you guys for coming on. It's the first time I've seen you on here. I appreciate, you know, the love and support, you know, here for When Wellness and for yourself, most importantly, you know, wanting to improve your health and taking the time to watch something that can help you do so, as for now. So we got for you, folks. We'll see you tomorrow, baby. Not sure where, not sure when, but we'll see you then. Have an amazing Sunday. Thank you guys very much. And happy When Wellness. We'll see you tomorrow.